everyone, my name is Michael Ward and tonight I'm sitting in for Anderson Cooper for this special program. Welcome to the Health News Network on CNN. This special health report will address the issue of telemonitoring in heart failure and its role in reducing 30-day rehospitalizations in patients with heart failure, and how the 8 essentials of doctoral education for advanced nursing practice are met through the DNPU program at Brandman University. Specifically, we are here to demonstrate how this clinical scholarly project addresses these 8 essential components of doctoral education for the advanced nursing practice. So let's take a look at the problem. Heart failure is a pervasive diagnosis with a worldwide incidence and prevalence approaching epidemic proportions. And despite progress in reducing mortality in patients hospitalized with heart failure, the diagnosis still carries high morbidity and mortality, while rehospitalization rates remain stubborn, ranging between 10 and 50% within 30 days of discharge. With more than $31 billion spent annually, half of this on hospitalizations, heart failure is acknowledged as an immense societal burden, both from a healthcare and economic perspective. And this is despite progress in the diagnosis and management of heart failure. With more than $31 billion spent annually, half of this on hospitalizations, heart failure is acknowledged as an immense societal burden, both from a healthcare and economic perspective. And this is despite progress in the diagnosis and management of heart failure. Telemonitoring has potential for patients with heart failure who encounter healthcare access difficulties, as deterioration in their health status is often heralded by an increase in weight and a deterioration in their clinical status days or even weeks prior to requiring hospitalization. Importantly, telemonitoring has the ability to overcome access difficulties, whether these are related to geography, infirmity, or financial concerns that may make frequent clinic visits difficult for these patients. So what is telemonitoring? Telemonitoring uses the transfer of physiologic data, such as weight, heart rate, and blood pressure, from the patient's home to their respective healthcare provider, permitting more frequent access of the patient's heart failure status and earlier recognition of hemodynamic deterioration than would be feasible in standard clinical practice, while acknowledging the underlying principle that hemodynamic deterioration precedes clinical deterioration. Therefore, can telemonitoring reduce heart failure-related 30-day readmissions compared to usual care? In order to evaluate this claim, I will undertake a quantitative, retrospective, quasi-experimental clinical scholarly project comparing clinical outcomes in patients with heart failure after a discharge from hospital utilizing telemonitoring and those receiving usual care. There is evidence to support the claim, and importantly, a Cochrane review has demonstrated that structured telephonic support with telemonitoring for patients with heart failure reduces the risk of all-cause mortality and reduces the risk of heart failure-related hospitalization. All in all, confirming the efficacy of structured telephonic support and telemonitoring as a component of outpatient heart failure management. From a local perspective, this project is important, as to this point, no such investigation has been undertaken. Combining e-health technologies and healthcare technologies and exploiting the synergies that exist between telemonitoring and structured telephonic support is the disruptive innovation and leadership that Christensen, Grossman, and Wang called for. Therefore, at a minimum, this project will establish foundational evidence regarding the clinical effectiveness of telemonitoring as it pertains to this particular clinical setting. Almost 70% of all direct and indirect healthcare associated costs with heart failure result from hospitalizations. As such, advanced practice nurses should advocate for innovative and multidisciplinary approaches to assess for subclinical signs of heart failure decompensation. like telemonitoring and structured telephonic support, in order to shift the focus from crisis management to health management. Advanced practice nurses should anticipate the needs of heart failure patients and both advocate for and coordinate telemonitoring as a component of a comprehensive, evidence-based disease management program, particularly when healthcare access difficulties are anticipated after discharge. The advanced practice nurse is fundamental in ensuring evidence-based practice, commitment, and application at the point of care. Quality and financial measures will continue to influence both patient, provider, and payer choice. As nurse leaders, advanced practice nurses should acknowledge and be knowledgeable about their organization's performance measures and be active participants in organizational leadership discussions regarding the management of patients with heart failure. As clinical nurse leaders, advanced practice nurses should engage in healthcare policy discussions through local, regional, and national organizations in order to influence healthcare policy regarding the management of patients with heart failure. In conclusion, in October 2004, the member schools affiliated with the American Association of Colleges of Nursing voted to endorse the position statement on the practice doctorate in nursing. The DNP is designed for RNs seeking a terminal degree in nursing practice as opposed to a research-focused doctoral program. Landmark reports by the Institute of Medicine in 2000, 2001, and 2003 focused attention on patient safety, the state of healthcare delivery, health professions education, and leadership for nursing practice. The translation of research evidence into practice is a fundamental component of a clinician's responsibility and a leadership responsibility. In 2001, the Institute of Medicine demonstrated the remarkable lag between publication of research evidence and translation into practice. Evidence-based practice is the mechanism by which the chasm between research and practice can be bridged. The implementation of evidence-based practice in and of itself is complex. However, if there is a sufficient evidence base, translation of this evidence into practice is required. This clinical scholarly project aims to fulfill the essentials of doctoral education for advanced nursing practice. Thank you for watching this special health presentation on the Health News Network on CNN. I'm Michael Ward, and Anderson Cooper will be back tomorrow evening.